Expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Hospital comes.
Morning.
Good morning.
So we continue.
Right, of course.
That was a
I don't
great
need
show.
that. Right, so what we had to
show.
have is a veterinarian, of course, and now we have someone that takes care of people, just like you take.
We got the lawyer
Coming afterwards. Yeah. No, but let's talk about this new subject. New subject.
Bruxism.
Bruxism. I have no idea what that is.
If you want to write it down, because we have
I'm going to do
this
that.
is the wonderful world of wellness.
Oh, that's
the
right. Wonderful world.
Pencil talk.
Okay.
Bruxism is B as in boy, R-U-X-I-S-M.
Right.
Bruxism.
And what is that?
That's when people grind their teeth. It's teeth grinding.
Yeah.
Or what we call also jaw clenching.
Jaw clenching.
So I had a patient, because you would think of grinding your teeth, who do you go to? Do you go to the psychiatrist? Do you go to the psychologist? Do you go to the dentist? Do you go to the doctor? And to me, the doctor, some people call doctor the gatekeeper. The doctor should be the informant. The person come, I have this condition. Can you treat it? Or what is the best path for me to follow? And when you look at grinding a person grinding their teeth, basically that's just the clenching of the jaw. That's what happens. And it happens a lot more frequent at night when people are sleeping. But when it gets really severe, it can happen during the daytime. Now, we know of grinding teeth in kids. Because, we lose those baby teeth as we grow older, we really don't bother much with it. Maybe get a mouthpiece or some mouth guard and put it on and what have you. But it's interesting to see that adults also develop bruxism. And it can be very damaging because once you start grinding your teeth and you lose the enamel of your teeth, then it starts going down, then it become infected. You can develop cavity. And I detected on patients when they come to me and I look into their mouth and I see that the size of their teeth have decreased by 25%, 50%, sometimes even 75%. So they have only the root of their teeth in the gum and everything else is gone. And the problem when the patient goes that far is that there is nothing else you can do but to extract those roots out now. So we have to consult the dentist, get all of those roots out, and then make dentures for them and what have you.
Okay, so how does someone know they have this? I mean, if they come into you, you ask them
if they live alone, it's very difficult because you grind at night and you might not even notice. If they live with the partner will notice.
Does it make a noise?
Because you start grinding your teeth is just going left to right. And it's just basically taking like two metal and you're grinding those two metal all night. And it's very annoying for the partner to listen to you grind your teeth. Some people even throw up. They get nauseated from listening to the other person grind. So the grinding of the teeth is it can be very very damaging. It's what we call a parafunctional activity instead of a dysfunction. It's just a parafunctional activity, and it's controlled by the subconscious in the brain. So it is important to have a teamwork, to help you, because just putting the mouth guard is not the final treatment.
Okay, so what's
just like everything I tell my audience, let's get to the root of the problem. Let's find out. Let's find out what is causing the bruxism. So bruxism is not a reflex. Some people want to call it a reflex, like a knee jerk reflex. It's not that kind of stuff. Okay, so bruxism is more of a habit that you develop, and it usually can occur during sleep, but also while the patient is awake. And what happens when the patient is awake is the subconscious processes can go on unchecked. So I tell you, I have one of my colleagues from Thailand that he has severe bruxism, very bad. And when he's in Thailand, when I'm visiting him home, he doesn't grind that much because he's communicating on his own language. So it's a little bit more comfortable, but he still grind, but not that much. But when that guy come here and he sit a few months ago, he came by. We're sitting in my conference room. You seen the size of my conference room, and I'm sitting on my chair at the end of the table, and he's sitting diagonally at the other end of the conference room, and he's grinding, trying to listen to the English language and understand what was being said, trying to comprehend the conversation. He was grinding so loudly that it was disturbing to the conference. That's how bad it can be. So once the person, once the subconscious processes go unchecked, then the bruxism will take off, even during the daytime, or even worse at night when the person is sleeping. What is important for the audience to know that there are many causes that can produce bruxism, such as allergic reaction, some medical ailments like digestive disorder and anxiety can produce bruxism. Very, very important is in trauma. People get into a car accident and they say, "Oh, I'm okay. My back doesn't hurt," but they might develop, if it was a severe trauma, and you start in your mind going over and over the accident at night, then you might start developing the habit of grinding your teeth, or bruxism. So a trauma can be the cause. A person that goes to the war and come back from war and can be traumatized from all the killing he or she have seen and what have you, and they get traumatized. A person that goes to work and they are stressed out at work. There's so much thing to do and so much stress, and they lying to me, and they might develop bruxism as a result of that.
Well, wait. So this sounds like it's very mental to me.
It is mental. It can be digestive. It can be digestive disorder. It can be mental related. It can be allergy related. So the thing is that once bruxism become a habit, the reason why it continued to happen is because the original stimulus that have produced the condition, the bruxism, the grinding, can be now removed without ending the habit. So the patient continue. And that is why when I saw this patient this week, I gave her a bit among the options. I said, we can do hypnotherapy to help you out. She got very scared. I said, oh my God, what are they going to discover? I said, nothing besides bruxism. we are not going to go into your sex life, how much money you took from home, or nothing like that. It's just the bruxism. You can do hypnotherapy. You can do psychotherapy because it's a habit. So you can break the habit with psychotherapy. And there are other medical conditions that we can also use to help you. But going back to the causes, do you know that medication can produce bruxism? Grinding of the teeth?
And how?
If you take amphetamine, used very commonly by people, or any other stimulant, the stimulant can make the muscles clench. So some people will, instead of complaining of bruxism, they say, I'm getting cramping. Getting a lot of cramping on my leg. And you usually will look at the medication to see if you're getting cramping because of the medication. the same medication, instead of producing cramping of the leg, it take the muscle that we use for biting, and it overstimulate those muscles, those medication. And by overstimulating, especially at night when you are relaxed, then the overstimulation really take over. And then you develop the habit because of the medication. And then the person can come off the medication, but stay with the habit.
Okay, just give me a minute. I want to tell everyone who you are again and give you give you a
Andy
place.
Mencia.
Dr. Andy Mencia, who is, of course, a geriatric physician. And he really has he's founded something very special. It's an adult geriatric care medical center that has so many specialists there. Let me read some of them too.
Well, a team.
A big team. Yes,
Yeah.
I know you are. And a lot of people talk about that. Of course, your Dr. Rosemary's the dentist, and you have an ophthalmologist, a neurologist, a cardiologist, weight loss program, of course, the geriatric
Dietitian.
medicine, the podiatrist, the dermatologist, the nephrologist, a psychologist, hormone replacement therapy, and your great dietitian and nutritionist. And let me give a
And
phone
the
number.
psychologist and
Yes.
the hypnotherapy. Oh, my
Yes,
God. It's getting big.
it is. It's so big and so wonderful. It's a wonderful world of wellness. That's really probably should be your new name of your institute, the Wonderful World of Wellness Institute. Medicare and most insurance is accepted. Call for an appointment today. Let me give you that phone number. Remember, this is Pencil Talk Radio. It's 954-489-1345. 954-489-1345. They're located at 1608 East Commercial Boulevard in Fort Lauderdale. And go to their website. You'll be able to see a lot of the shows that Dr. Mencia has done and lots of information. It's geriatrics.tv. Geriatrics.tv.
It's so interesting. I was talking to a very prominent individual that came to see me as a patient. And of course, everybody in the office, oh, so-and-so, oh, so-and-so, oh, my God. And they want to take picture and look at this guy and what have you. So I say, I do I love marketing. And, I try to promote my concept of medical care because I believe it's a unique concept, what we're doing. I don't think we are doing what other people are doing out there. So I say, but I need to know from you, because he came all the way from Miami to see me, way down Miami. I say, what motivated you to come to this office? And he said, Dr. Mencia, everybody should be motivated. You know what? When you want good food and you're going to go to a good restaurant, that restaurant is usually not around the corner. You drive way out there to get to that restaurant.
It's called a destination.
And if you are determined to go and eat the best food with the best chef and the best care for yourself, you go and drive there and you sacrifice time to go and see somebody, to have somebody. So I come to you because of that. And I will drive here as much as I have to and as often as I have to because I'm looking for this kind of care.
Wow, that's a good one. We need a testimonial from him.
I know, I was
You
telling
have to
him.
have a testimony.
Yeah.
And how old is a person like that?
He's 48.
Ah.
48.
That's amazing. Well,
And
I agree.
He wanted to take care of himself before he turned 50.
I agree.
He said, I have 2 years to get everything squared away before I turn 50.
That
And then I told him, you know what I told him?
What?
I say, well, I won't say his name.
no.
I can say Michael. That's his first name. Michael, we are going to do everything right, but then you know what's going to happen? He said, what, Dr. Mencia? I say, 60 years from once you turn 50, 60 years later, you're going to come back and say, thank you, Dr. Mencia.
That's right, 110.
Thank you for taking
That's
great care
right.
of me.
It's true, but no, that's what you preach. That's what you love. I wonder,
So let's go back to
I want to ask you about.
Bruxism.
I have a question about Bruxism.
Uh-huh.
Someone I know who says that she clenches and grinds her teeth at night, and so she consequently chews gum, and she says it helps her. Now she can't do it while she's sleeping, but she
Right,
does it during the day.
exactly.
Tell me about that.
Well, chewing gum distract you. It's a distractor.
I see.
But
Because it
it was
annoys me, frankly. when
It's
she
very
chews
annoying
gum.
because I had a employee that we almost got rid of her because she was chewing like, and really distracting. I said, that's not professional for you to be taking care of people with that behavior that's really bad. So he told me, she told me I have bruxism. So I treated her. I say, look, let me help you. Let me treat you. But chewing gum is just a distractor.
Oh,
But
that's
what you're
what it
trying to
is.
do is get the muscle tired, the masticating muscle, get them tired so that they don't have enough strength to grind. But then they don't have strength either for you to speak or for you to eat properly.
It's funny, of all the topics that I've heard in all my years, I've never heard of bruxism.
Bruxism.
I mean,
You
that-
learned something new
Yeah,
today.
big time. Where's the name
Anita
come?
is learning something new.
Oh, I'm always learning something. I always learn
What
something
are
new.
the signs? Usually when we have a condition in medicine, we want to know what are the signs and symptoms, because a lot of doctors do not N-O-T, treat bruxism. They don't even know what it is. So let me tell you what the signs are so you can bring it to your doctor and then you can carry on from there, or just come to the center and we'll help you. But the signs are you're going to have jaw pain, a lot of pain in the jaw, and some people misdiagnose you at TMJ. The person will develop headaches. Very frequently, the headaches are produced by this condition. And you go and see a neurologist, they start treating you for the headache. They are not treating the root of your problem. It can produce what we call in dental care occlusional trauma. So when you bring your teeth together, they don't occlude properly, and therefore you cannot masticate, you cannot bite on your food properly. And it can even break your teeth, of course.
I was just going to ask you about that. Couldn't you crack them and break them and
They
make them
usually,
loose?
yeah, because once you use the emerald of the, that's the stronger part of the body. Once you lose that, then the teeth start getting exposed. And if you see a person with bruxism, the alveolar teeth is cut off. They're like somebody clipped them off.
My goodness. Does Dr. Rosemary see this when she examines when
all
people
my
come?
All my dentists are, because we have conferences, and if they don't know about bruxism, I fire them. So
So it's pretty important, is what
yes,
you're saying.
Yeah,
right?
they all know. The psychologist, the dietitian, is the leading cause of occlusional trauma. The leading cause of occlusional trauma. What I'm trying to tell the audience out there is that you're going to spend so much money in occlusional trauma when you go to the dentist, and you can prevent spending all that money by taking care of the root of your problem.
Is there a medication that people would go on?
We're
getting to that. He's got his whole list.
So those are the signs that
Okay,
you have.
those are the
Let's talk
signs.
to the symptoms.
Okay.
So the signs are things that we can see. The symptom is that the person can be very anxious, and you have to bring that out with your doctor. It can be depression. The person can have earache. And it's the person that goes to the doctor and say, I had this severe earache, and you gave me an antibiotic, and I think it worked. I don't know, but it came back, the earache, and they send you to the ear, nose, and throat, and the ear, nose, and throat take a look in there, say, I think this person is crazy. This ear, they look perfect. Let me give her another antibiotic, or let me give him another antibiotic, and off we go. So the earache that have no other reason to be, it could be secondary to bruxism. It can be secondary to an eating disorder. The person can also develop neck pain, insomnia, headaches, migraines. People can have migraines due to bruxism. And you hear when people hear, I have this ringing in my ears. It's called tinnitus. Tinnitus can be produced by bruxism. It's one of the symptoms of bruxism. The person can have painful jaw and gum reception.
Amazing.
And then it can lead, because remember, you have that TMJ here. So when you are using those muscles with a lot of power, it can lead to arthritis of the TMJ, or those joints here.
Absolutely amazing.
So how do we make the diagnosis? To make the diagnosis, usually we need to do what we call an EMG, electromyography of the chewing muscles. And that's the masseter and the temporalis, for those of you that want to learn. But basically what we do, we put the electrodes on these two muscles on both sides of your face, and you go to sleep with a little machine, and the machine will detect every time you clench. Have you seen those biofeedback machines
I've
that they put it on the forehead?
Yeah, I've done biofeedback.
I done biofeedback too. And when you put the biofeedback, it's detecting when the muscle going on the
yes,
tension.
and you see it. You see it on the screen.
Right. So this machine is record like a biofeedback machine. How often and with how much strength you clenching those muscles, you strengthening those muscles.
You have that machine? I mean,
yes, we have an.
So you have a way for people to be helped with this.
Absolutely,
fantastic.
And usually the machine is necessary for the non-believer. So you have this stubborn man that the wife says, "You're clenching your teeth. You're clenching." No, I'm not. And the teeth are almost half gone. So sometimes if we have to prove it to them, we say, "Okay, we'll do the test." But it's, the diagnosis can be easily be made clinically. You can make it at home. If you go through this list we just went through, and you can go on my website and listen to the whole lecture again and make notes, and then just try to see if you have this. And if you do, then follow up with, usually if your primary care doctor is well-rounded individual, and they will be able to help you when you hear the treatment that are out there, as well as your dentist if they are into prevention.
I think this is amazing. I mean, this is the most foreign medical discussion that I have ever had. I mean, I know about TMJ and I know about tinnitus, but there are people
to put it all together,
because there are people that go and they probably think they're crazy. Yeah, they think they're crazy, and it turns out to be that.
Mm-hmm. And the thing is, see, what people get confused, even the patient, they get so confused because remember what we said: you have a trauma, or you have a medication that you take, or whatever one of those causes that we already mentioned produces the habit. Now the stimulus is taken off, but the habits continue. And eventually somebody tells you that you have this habit, and it's very hard to go back and put it together and say what produces it. Because the stimulus is already gone. It could have been 20 years ago. And you still have this problem, and it needs to be treated.
And so let me, I don't know if you...
And if you want to look, if you live with your mother or your father, just look at their teeth. If the teeth go from the gum all the way to the top and it's intact, most likely they are not grinding. But if you see that the teeth is like if you're taking a nail clipper and you're clipping them off, and you see the teeth being clipped 25% off or 50% off, that person have bruxism without you listening to them grind.
So people who use the teeth, they have, what do they call it? I'm sorry, I lost the word. You put
muscle.
in your mouth. No.
The guard.
Yeah, the guard. Now, will that help them?
Well, it's like if you have a skin cancer, and I put a bandage on top of your skin cancer, is that going to help?
No,
I don't
really.
think so. It might prevent the infection, but it won't help the cancer go away. We have to dig that cancer out, go to good skin, and let the good skin regrow, and then we have taken care of the problem. So the mouth guard is part of the treatment, so you don't keep damaging your teeth, but it's not the final answer.
Absolutely amazing.
Is that your final answer? No.
No. But
so when it comes to treatment, I tell you what's out there for treatment for the audience to keep track of this, and we're gonna have an article on this on the
I would think
on
so.
Boomer Time, so that you guys can also read it there or go to the website.
Unusual.
The dental guards. Now, dental guard, you don't go to a pharmacy and buy a mouth guard. You go to a dentist that produce a custom-made dental guard. And you get a dental guard, and what this is going to do, this is going to be the bandage. It's going to put it on your teeth and help you protect.
Get relief, maybe, a little bit.
No, just protect. It's just
protect.
protecting from you to continue to damage your teeth anymore.
Does it give you relief at night?
The guard, no, it doesn't relieve anything. Just the grinding will still be there, but you're grinding now the mouth guard,
I see.
not your own teeth.
I see.
So instead of having all your teeth taken out 20 years from now, you still have your teeth. You just have to change the mouth guard until you find somebody that can treat bruises. And if you live really, really far, because this radio show goes through the internet, get the mouth guard until you come and see me.
Can you kiss with a mouth guard in your mouth?
You can kiss
because
with it
a lot of
because
times
it's
at night.
custom made. It's
Okay,
custom made.
because at night you want to kiss, and
if it's like a little mushy or something, it's okay. But if it's gonna
mush.
be heavy duty stuff, then you might want to take that off. If it's like we're going for the whole 9 yards. So the mouth guards.
Get rid of your bruxism, please.
And the splints will help. The splints is good because it moves the jaw a little bit forward.
Where do you put the splints?
In the mouth. It's done by the dentist, and it fixes the jaw a little bit forward, and it sort of prevent the muscle. It put the muscle in a position that is very hard for the muscle to try to contract when the subconscious process is going on.
Okay.
And then, of course, biofeedback. For those of us that have tried biofeedback, that have used it for other things, biofeedback can be very effective. Then other thing that we do on my side of the practice is we do the Botox injection. And what we do is, Botox, we know Botox to be good for wrinkles, but it is used medically for urinary incontinence, fecal incontinence, and even for bruxism, because we inject those muscles.
And migraine headaches.
A migraine headache. So it's have a lot of medical use. It's not it's not only for wrinkles. So Botox can help, and usually you have to repeat the treatment every 3 to 6 months until the habit just go away. So you don't have to do it for life. What about dietary supplement? So usually we look at the patient at the blood test and see if there is any dietary supplement the patient might need, just like we do for cramping of the legs. So we look at calcium, magnesium, and other supplement to see which one of those is the patient deficiency that can produce the same thing that produce cramping can worsen the strength of the masticating muscle.
Well, we did it again. Bruxism, huh? Wow, this is a wonderful show.
Bruxism.
Bruxism. Bruxism, right?
BRUX as you are here. No, BRU as uniform.
Yeah, XISM. Bruxism. Well, we will do something. That is amazing, and that was a wonderful show because I learned so much. And I think the best part of it is that there are people who are being treated for other things when it's really bruxism.
People that don't even know they have it.
But now they do know because you did it.
Look at your mouth.
Oh, right. I always do that. Well, thank you, Dr. Mencia. Remember, everyone, do call. No matter where you live, you will want to go to some fantastic doctor.
954.
He loves to give his own number.
489 1345.
And he's down there right near Holy Cross
And
Hospital.
we'll open on Saturday.
Oh, he's going there right now on Saturday, which is unique. He is such a great doctor and has a wonderful, wonderful staff. Thank you very much. Oh, wait, go on to the website, geriatrics.tv. Thank you again.
You're welcome, Anita.
Okay, we're
Thank
just going to
you,
go
Richard.
now to a fast spot, and then we're going to hear from Joe Karp. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.
It's Boomer Expo time. Hello, I'm Anita Finley, and we want to see you on Friday, July 20th at the Seminole